Welcome to This Explainer. Let's dive right in and explore an unexpected medical mystery that affects millions of men. We're talking about a hidden link between your hands and penile curvature.
Here's a medical connection that surprises many men. A tight, cord-like band pulling your palm or fingers inward could be a major clue about your penile curvature. Now, I know what you might be thinking. That sounds like two completely different worlds, right? But today, we are going to connect those dots.
A surprising medical connection. From the palm to the pelvis. Let's start by looking at how two seemingly unrelated body parts actually share a very specific biological problem. It turns out, if you look under the surface, the tissue in the palm of your hand and the tissue inside the penis have a whole lot more in common than you might think.
What's really wild is that the underlying issue in the hand is virtually identical to the issue in the penis. In the hand, we have something called Dupuytren's contracture. This happens when the tissue in the palm thickens and shortens, eventually pulling the fingers inward so they just can't straighten out. And then we have Peyronie's disease. This is when a remarkably similar type of hard scar tissue forms under the skin of the penis, causing it to bend or curve, usually during an erection. Both of these conditions are, at their core, connective tissue disorders.
Connective tissue and collagen, the body's biological glue. To understand why this happens in both places, we really have to talk about the material that holds our bodies together. Think of this as the biological glue that gives us shape and structure.
Connective tissue acts as your body's ultimate support system, providing structure and elasticity to places like your skin, your joints, and certain organs. It's basically the scaffolding of your entire body. When this tissue is healthy, it stretches and moves exactly like it's supposed to.
The primary building block of all that connective tissue is a vital protein called collagen. And hey, collagen is perfectly normal. It's exactly what you need for healthy scaffolding. But when the body makes way too much of it in one specific place during a healing process, it clumps together. Instead of being flexible, it turns into rigid, hard scar tissue.
For example, inside the penis, there is an elastic sheath called the tunica albuginea that relies heavily on healthy, flexible connective tissue to function. You can think of it kind of like a thick, rubbery balloon. When blood flows in during an erection, this sheath is supposed to stretch out smoothly and evenly on all sides.
How scar tissue forms. Wound healing gone wrong. So what actually triggers this sudden buildup of excess collagen in the palm or the penis? Why does the body suddenly start overproducing this stiff scar tissue? Well, it all comes down to wound healing.
Here is how the timeline usually plays out. Basically, a minor, often completely unnoticed injury prompts the body to heal itself, but the healing process totally overreacts, leaving behind a hard plaque. For the penis, these tiny microscopic tears, or micro-injuries, often happen during regular sexual activity or sports. Honestly, most of the time, guys don't even remember the injury happening, but instead of healing normally, the body sends way too much collagen to the site, forming a flat, hard scar right under the skin.
Because this new scar tissue absolutely cannot stretch like normal tissue, it acts as an anchor. Remember that balloon analogy? If you put a piece of heavy duct tape on one side of a balloon and then blow it up, the balloon is going to curve right toward the tape because that one spot can't expand. That is exactly what happens here. The hard plaque acts just like that tape, pulling the fingers inward in the hand or causing the penis to bend, curve, or even shorten during an erection.
These shared risk factors explain why a man experiencing this wound healing glitch in his hand is statistically much more likely to experience it in his penis. We know that genetics play a big role. If your father or brother has Peyronie's disease, you're definitely at a higher risk. Advancing age is another huge factor, as tissues naturally change and become more prone to injury as we get older. And health conditions like diabetes can also seriously interfere with normal healthy wound healing.
Managing these conditions, understanding the phases and options. Now that we understand the biology and the connection to how our body heals, let's look at how this condition actually behaves over time. Spoiler alert, it doesn't stay the same forever.
Peyronie's disease actually has two distinct phases, and knowing whether your scar tissue is actively growing or has stabilized is the crucial first step in managing it. The acute phase can last up to 18 months. This is when the scar is actively forming, meaning you might feel pain, and the curve might actually be getting worse. Then comes the chronic phase. The inflammation stops, the pain usually fades away, and the curve locks into place and stops changing. The good news is there are multiple medical and surgical ways to address the curvature once it has stabilized. If the curve is mild and doesn't cause pain or interfere with sex, doctors often just recommend observation. For more noticeable cases, there are medical therapies. This includes traction devices that use gentle stretching to encourage tissue adaptation or specific injections that use an enzyme to literally break down that excess collagen block. And for severe cases that have completely stabilized in the chronic phase, surgical interventions can actually remove the plaque or straighten the penis.
So if a glitch in wound healing can link our hands and our sexual health, what other unexpected medical connections is the body hiding? This unexpected link builds to a much bigger picture. Our bodily systems are deeply connected, and paying attention to a change in one area can reveal vital clues about another. It's an awesome reminder that our bodies don't operate in isolated silos. By understanding the root cause, like a simple glitch in how the body heals itself with collagen, we can demystify conditions that might otherwise feel confusing or embarrassing.
If you'd like to learn more about Peyronie's disease and your treatment options, click the link in the description below.